Dr. Roshani, welcome.
Good morning, Dr. Roshni. Third time.
Hi, Anup, Shashi. It's a hat trick. I'm honored and excited to be here with you all again.
So thank you. And I think, see, the crowd who's watching MHC always knows you very well. So you are the first doctor in MHC one, and people still recall some of the quotes and lines which you told. So I think for the benefit of the new people, new attendees, Dr. Roshni is an American board certified endocrinologist. She is practicing in Mumbai, and she is an endo who has left behind all this drug practice, and she is totally into nutrition. Plus, not only nutrition, but even into the a bit of holistic practice around low carb. So welcome again for the third time. So in MHC3, you are not only in the inauguration, but you are also in the final session of where we are going to debate on certain topic. Yeah, Dr. Roshni, welcome again.
Thanks a lot. And I just found out earlier today a fantastic news, which was today is a very big anniversary for Anup in terms of your own health journey. So I think, Anup, it's full gratitude for your own personal transformation. We cannot be more thankful that people get the health results that you got. And not only did you stop there, you didn't stop there, you kind of took it to create everything you've done with D-Life and with Shashi, both of y'all. Hats off for what you're doing with Metabolic Health Conference. One big cultural change which y'all are pushing in India, which I must appreciate, is you're bringing people together. Sometimes India gets internally competitive. Okay, and you all are creating a community. We need more of this. And my extreme gratitude and excitement for the fact that you've put such a conference together free of cost. Of course, you're doing great work with your D-Life, coaching and all that. And we need more of this. We need 1,000 Anups, 1,000 Shashis, 1,000 of all of us on this call today. I like what Mr. Pachauri also said, that it's, we need to come holistically into this. So just one thing I might say, which we should definitely also continue doing together, all of us, is yes, nutrition is the first step. Food is medicine, and we all understand low carb. We agree. We've seen it in not only our own personal health transformations, we've seen it in our patients, in thousands and thousands of patients over a decade of clinical experience now. And for me, like I mentioned in my book, nutrition becomes the first wheel of the lifestyle car. Just for your audience, we always want to start with nutrition first. What you put in the body is that, raw material for everything else you want the body to give you back. And then, of course, looking at sleep, stress management, exercise, maybe intermittent fasting. All of this combined can help India, which is definitely metabolically at a crisis right now. And the core hormone imbalance, since I'm a hormone doctor or a metabolism doctor, right? We're talking metabolic health. For the longest time in my fellowship, I had this degree which says fellow in endocrinology, diabetes, and metabolism. That's the term. But the metabolism piece of it, most of us in practice, we were writing dawa goli. We were not really focusing on metabolism, actually addressing metabolism and improving metabolic health. Now I know what it means. And by these comprehensive lifestyle changes with nutrition as the first step, we can definitely do a lot for the country. So happy to be here, excited to kick things off with you, and very excited to have that session with you on Sunday.
So thank you very much. We are looking forward for the session. I think for the viewers. So this is going to be a debate, a sort of a discussion, rather say. I will not say it's a debate. I will say more of a discussion, though we have termed it as a debate. So Dr. Roshni Sanghani and Dr. Deepti Arora. So both of them, and I'll be moderating them. So they will be discussing on, is low carb sustainable? I think this is a very, very crucial point in India where whenever we say that as a coach, when we say that you have to do low carb, so people say, is it sustainable? So this is a big question which is coming now. No one really understands what is sustainable or what is their definition of sustainable. So I think all these things we are going to discuss. Not only this entire event, MHC3, is what we have done is no doubt the focus is on low carb, but we have gone a step behind that. We are trying to find out what to do about the addiction. The addiction to not only the carbohydrates which are, but what about the addiction to ultra processed food? The addiction to ultra processed food is again we are going to explore with a lot of experts. And also the big discussion, especially centered in USA, that about seed oils. So seed oil is something which is used in a tremendous manner, not only in India, but globally also. So we'll find out how seed oils also impact our metabolism, impact our metabolic disorders also. So I think this something we have focused slightly little more additional way. So as time goes on in every different metabolic health conferences, we are going to add some new topic, which will try and make it little more holistic coverage, so that we just don't focus only on low carb, but we are going to focus on the other aspects also. Thank you. Anup?
Yeah, before we know session ends, people might not know that both Dr. Roshni and D-Life, they came to fore in 2014, though I've been talking about low carb since 2011, 2012. And since sustainability is the topic of debate, I would like to write the preface of that, in this session before we close, that since both Dr. Roshni and D-Life has survived all these 10, 11 years, it is very sustainable. Thank you. Thank you for coming, and hope we'll see you again.
See you soon. Keep it up, and very excited for the seed oil focus. You've got the right speakers. The panel curation that you do every time is fantastic, and I'm very excited when your hosts will question these experts specifically on the oils that we use in India, the cooking mediums, the cooking fats in India. So very excited for the audience to get that benefit.
Please get in Ira. I mean, she had just gone for a break.
Hi, Ira.
Hi, Hi, Dr. Roshni. Great to see you again, and you've been part of all 3 conferences, and we look forward to having you all more and more, and your session especially. And it's going to be great. I know that you bring some wonderful insights to the conference, so really look
Keep
forward
up the
to
great work.
Yeah, thank you.